Welcome to Local Edition. I'm Brad Pomerance. We're in Sacramento today in the state capitol. We are joined by Toni Atkins. She is the Speaker-Emeritus of the California State Assembly. She's a candidate for the California State Senate. And I just must ask, how does a kid from Appalachia with no running water become the Speaker of the California State Assembly?
Well, it's something I certainly never envisioned. As a kid growing up in Southwest Virginia, California was actually one of my favorite states.
Of course it was.
I thought Sacramento was a great capital, and I loved it.
Right.
I never thought I would live here, but I ended up here, joined my sister when she was in the Navy, and, you know, I didn't plan this, but I got involved in politics locally in San Diego.
And let's talk about that. You were on the City Council for 8 years.
8 years.
Was then elected to the California State Assembly, and then at the end of your 6-year cycle, because you still are part of that term limit cycle, you were named Speaker. It's a remarkable journey.
Well, it is, and I think you know, what gave me this opportunity, ultimately, we talk a lot about this in California, is education. I had a really good education in public schools growing up in Virginia. Pretty homogenous community.
Understand.
Not a lot of the issues we see here in California with all the cultures and languages and social issues.
Right.
So I had an opportunity to go to good public schools, managed to go to college, the first in my family to graduate.
Right.
And it just gave me a whole different perspective of the world. I wouldn't be here without having had that opportunity.
And you are much more than what I'm about to ask about, but you were the first woman to be a part of the LGBT community that became Speaker of the Assembly. I mean, that is historic. Is that part of the journey, or is it separate from the journey?
It's part. You know, I'm incredibly mindful that I'm a woman, that I'm a member of the LGBT community, and frankly, I'm the first San Diegan to become the Speaker.
And that's relevant.
And the first Appalachian.
But, there you have it, right. That's another story.
But the first San Diegan. And you know, so you are mindful of your place in history.
Right.
I stand certainly on the shoulders of a lot of pioneers in the LGBT community, in the women's community, but really, you know, I'm mindful that I'm still part of making history. And I'm fortunate to have had people to give me the opportunity. John Perez gave me an incredible opportunity to be in leadership.
Right. He was the first LGBT member to become Speaker, and you were the second, and it's pretty remarkable. It happened fairly quickly, and it really says a lot about our state and where we are as a state, or does it?
Well, it does. I mean, it thankfully, you know, we still have a ways to go. The transgender community, I sponsor and carry a lot of bills to support equality and equal rights for the transgender community. So we're not completely there. Women aren't completely there. Look at the presidential discussion and look at what women make compared to men. You know, this past year we passed the most far-reaching fair pay bill in the country. So we haven't arrived, but it sure does feel a lot better than it did 20 years ago.
And when you mention women, it's hard to deny that women really saw their greatest numbers in the California State Legislature. Not recently.
No, early 90s.
Yeah, early 90s, kind of in the wake of the Clarence Thomas hearings.
The Year of the Woman.
The Year of the Woman, Barbara Boxer, Dianne Feinstein being elected to the United States Senate. And while female numbers are stable, they are at a certain level not growing.
Well, the lowest in decades, actually.
Oh,
We're less than 25% of the legislature. 120 of us in the Senate and the Assembly, 25%. So we're losing ground, not gaining ground.
Could it be, though, we're at a point where gender just doesn't matter?
Oh, I don't think so. I think it matters significantly in terms of some of the legislation that gets passed.
But in terms of the election to a body, I mean, I think about, for example, Chris Holden, who's a member of the African American community. He does not represent an African American district.
Right.
And so I'm wondering, are we kind of in a post-gender world, if I could say? I don't know that I'm not advocating.
Here's what I think. Here's whether we're talking about the African American community, women, LGBT, other ethnic populations. I think there is this feeling in our society that there is equality. Look how far we've come. So we've arrived, but the practice does not match where we think we are in our minds. When you see all the things we don't have. And I think you've got a younger generation of people who've grown up with more freedoms. And yet, when you see what's happening in reproductive rights and abortion in this country, we are going back. California was the only state several years ago, with my AB 154, to pass a bill related to rights and expanding rights.
Reaffirming, even if Roe versus Wade vanishes on the national level, we have a protected right.
Right.
I want to ask you, I'm sure that was one of your proudest accomplishments.
It was.
But during your term as Speaker, what were your proudest accomplishments? I can think of a couple. I'll start with water. I don't know if you would define that as a proud accomplishment, but I think it's hard to deny. Talk to us about the water bond and the bipartisan nature of it. The voters passed it overwhelmingly.
Right. Well, I think the thing I was most excited about by the water bond was there was an initial discussion that said, how many votes do we need in the legislature to pass this and to get a better package? And someone gave me that number, and it was far short of everyone. And I said, that's not going to work for California. This is an issue that impacts every single community. Republican, Democrat, it's actually less of a partisan issue than it is a regional issue.
True.
And so I really felt like we can't leave anyone behind. If we expect the voters to pass this, we have to give them a reason to support it. And so it made me proud that we were able to do that and leave nobody behind. Groundwater management, 150 years, California was probably one of the few states that doesn't have a groundwater management
Texas
program.
had groundwater management before we did.
I know it's policy. It makes your eyes glaze over.
But it's important.
For California, significant. I think some of the movement we've been able to do on income inequality and poverty in this state, we've lived through a decade of recession. I came in, we had a $26 billion deficit. That was hard. So I have lived through a deficit and the restoration of our fiscal stability.
I want to ask you about another issue that also crossed partisan boundaries, and that deals with a bill that did ultimately pass, physician aid in dying. That was a bill that really tore at the heartstrings of so many of us, whether we're Democrats, Republicans, North, South, East, West.
Right. It was a personal issue, not a partisan.
Right. But you were part of the leadership that was able to shepherd that bill to an ultimate conclusion and successful signing. Talk to me about that process, if you may.
Well, interesting. We were in special session, and so it enabled me as the Speaker to set new committees. And that bill stalled in the Health Committee. So under special session, we established new committees for transportation, because we have a transportation special session, and for health care. And I appointed a new committee, and it gave another renewed opportunity for that piece of legislation to be discussed and passed.
And that's part of the parliamentary prowess that one needs to develop as Speaker. And so give me a sense about what you learned being the Speaker and how to navigate the legislative process, the executive branch with a man who...
Right, and we didn't know the governor would sign that. Remember,
true.
It was getting it through the legislature, but it was, I think if people had put money on whether he would sign it, many would have said he wouldn't.
A theologian himself.
But it became a very personal decision for many, and he recognized that. He's very thoughtful. I think in terms of the ability to do things as Speaker, I really believe in fairness and, that you should do things in a way that is, of course, transparent, that is fair. People need to know what you're doing. But also, we're in a political world. And every now and then you see an opportunity to do something that you really believe in, and you take that opportunity. And, I took the opportunity, and I feel like it was a really important thing to do.
Her name is Toni Atkins. She is the Speaker-Emeritus of the California State Assembly. She is a candidate for the state Senate. That election will be held in June 2016. My name is Brad Pomerance. This is Local Edition. This is Local Edition. I'm Brad Pomerance at the state capitol in Sacramento. We are joined by the majority leader of the California State Senate. His name is Bill Monning. And as I drive through California, I'm amazed at how many times I see an establishment that is advertising for, I'll call them pet hotels. I'm not sure what else to call them. And I have friends who, at the beginning of the workday, they drop off their babies, and I don't mean their children.
Right.
They drop off their dogs at a pet hotel, and they have a great day, and then they pick them up.
Right.
But I understand recently there was a tragedy at a pet facility in Monterey, your district.
Yes, last year we had a tragedy in Monterey, a pet boarding facility where I believe it was 17 pets perished. There was one 2 years ago in San Luis Obispo County where I think 11 pets perished.
Also your district.
And it's also my district. And as we looked into this to understand, well, what are the regulations, we found out there are no regulations that regulate pet boarding facilities. We have them for pet stores, but not for boarding facilities.
Veterinary clinics, I presume.
That's correct. A veterinarian is licensed and held to certain standards, but no regulation of any kind for pet boarding facilities.
It's such a new business. I mean, 5 years ago, did they exist? I don't know.
Well, I think they've existed for a long time. I think what we've seen, and you allude to it, is the advent of pet spas, daycare centers, etc. So they've been a little bit more personified. But many families for years will leave a pet, and as you said, really a loved member of the family, they'll leave them at a boarding facility during their week vacation or 2 week vacation, and you entrust your pet with the belief that they're going to be well cared for, the place is well maintained, and that they've minimized safety risks.
Do you know if any of our sister states have adopted regulations in this space?
Not that I'm aware of. It's a fair question. We know they don't exist in California, and what we're doing is we're trying to create a foundational set of regulation. We're using pretty much the model that's used for pet stores. And it would be under the supervision and control of animal control officers who are usually county employees. And so what we create is a complaint mechanism and a fining mechanism. And the reassurance that I think is important to offer here, we believe that most boarding facilities are well run.
And they want to treat these animals well.
And they do it because they also care for animals. What we're looking for is those who are cutting edges, who are cutting corners, and who are putting the pets at risk. And we want to empower the pet owner if they believe that a pet has not been well cared for or that they've observed unsafe conditions, that they have a complaint mechanism to the county animal control officer who could impose fines, a first offense of $250, subsequent offense $1,000. But again, our goal is to make sure that the law-abiding boarding facilities are recognized as such.
Is there a private right of action, either now under the current law or as a result of SB 945?
We do not create a private right of action. We create a fining mechanism. It is regulatory. I think what we would find is that there's a current existing private right of action. If your pet perished in a fire, you would retain as a citizen. We certainly don't remove that right. If there's some tragedy, for a pet owner would have their own legal recourse. But what we want to create is a regulatory system where everyone knows what the rules are.
So have the counties spoken out about this? Because presumably it could be a bit of a burden. Will they need more officers as a result of this legislation? Is there funding for that? Or
fair question. Counties haven't weighed in through CSAC or on their own. We have been in touch with some of the counties in my jurisdiction, Santa Clara County. We've talked to some people with experience in both Morgan Hill and Gilroy who think it's a great idea and says it's long overdue. Let's get on with it.
What about, is there a pet spa association?
We will find out.
Once they hear this interview. Because look, I think it's important. This. Just make sure all the stakeholders are involved. And it seems as if you've tried to not create a whole new regulatory scheme, but just apply pet store standards to pet spas standards.
And so that's how we begin, and it will be informed. We're in the early stages. We've just introduced it, has not had a committee hearing. And as you know, the way the process works here is that it's a very open process in our committee process. We'll hear from stakeholders, and we're free, and I reserve the right to adapt, to amend,
always,
to address unforeseen, unintended consequence, or to further strengthen it to address the interests. Again, we want to protect the law-abiding folks,
of course.
Most importantly, we want to protect the pet owner and the pet. The pet is one of the most vulnerable residents, for lack of a better term, in our state. They have no voice except maybe a loud bark and maybe a bite, but they depend on us to create the circumstances for their protection and safety.
I want to shift gears and talk to you about a healthcare issue for humans.
Yes.
I think I may have told you, my wife has a chronic condition. She has Crohn's and colitis, and she's doing well, which is terrific. But suffice it to say, we've had a tremendous interaction with our insurance company, and overall it's been positive. Sometimes it can be difficult to access information from them or even get in touch with them. And as I understand it, my situation is not unique, that sometimes we're not sure where to go when we need to reach out to our insurance company. I fortunately speak the majority language, English.
Right.
There are many Californians that don't. And so you're looking to help folks that are facing challenges with regard to language and with regard to timely care.
Timely access.
Yeah.
So my SB 1035, it's designed to enforce existing law. We are, as Californians and under the Affordable Care Act, we're all entitled not only to have access to coverage, but to have timely access to medical providers. And so when a person has their health insurance plan, whether it's public or private, they usually have a medical card.
Right.
And that's what you present to the receptionist when you go to the doctor's office. What we propose is for that card to include a toll-free number to the oversight agencies, that if they're denied timely access, we tell them right on their card who you can call. Part of that timely access is, as you reference, is the right to interpretation if necessary. So with the evolving healthcare, the good parts of our evolving healthcare is we have extended coverage to many more Californians. It makes for healthier communities. The more people that have access to preventive care, et cetera.
So when you say timely access, does that mean that what does that mean exactly? There's an emergency and you need surgery right away and you can't get the pre-approval?
Right.
Explain.
That could be one example. Presumably, if it's an emergency, all policies have to cover emergency room access. One of the goals is that we invest more in prevention and try to get people out of emergency rooms. But let's say that you're following up from an emergency room visit and they said, see your own doctor, a week after this emergency room visit, and you phone doctors who are listed in your plan.
I knew you were going there.
And you can't find anyone who has an opening. And what this will force the medical plans to do is make sure they have sufficient doctors, providers in their network so that patients who are covered by that plan have timely access.
But let me ask you that because, look, I have dealt with narrow network issues with regard to my wife. And, while the Affordable Care Act seems to have been objectively successful in California, I'm not taking a position per se, narrow networks continues to be an issue.
It is an issue.
And so can this call center address the issue of narrow networks? That's tricky.
It can, because what the call center will do, first and foremost, it will take the information. So we have a catalog of if there are multiple complaints against a particular plan, that could go into some enforcement action. They will also help that patient navigate with their own plan, make sure, have you called your plan and lodged a complaint with them, so there's something in writing. Some people will just hang up and they're frustrated. I have to wait for 3 weeks or nobody will see me.
Will you come back and talk more about this because it's an important issue. His name is Bill Monning, Majority Leader of the California State Senate. We're in Sacramento. I'm Brad Pomerance. It's Local Edition. I got a story for you.
Yeah.
I got a story for you. This is Local Edition. I'm Brad Pomerance in Sacramento. We are joined by Chris Holden. He is the majority leader of the California State Assembly. And sir, it's odd, but over on the Hill, a bunch of bipartisanship is breaking out. I don't know what's going on there, but somehow, some way, Democrats and Republicans got together and passed what's known as the MCO tax.
Right.
Give us a bit of background as to why we needed this tax, managed care organization tax, passed.
Well, I think a couple of things. One, it was where we needed to step up and make sure that we were going to receive this grant from the federal government. If we did not do that, then we would have approximately a $1.3 billion hole in our budget.
Right. And as I understand it, if I may, the federal government said that in order for California to receive this $1.1 billion, they needed to impose a tax on all healthcare companies, not just companies that covered Medi-Cal.
That's correct. And as a result of that, though, it actually became sort of a tax reduction for across the board for the providers. So as you look at the way that the structure was set up, as this plays out long term, it will actually be a reduction.
So let's talk about that. You know, sure, we all love to have our taxes decreased, be it individuals or corporations. But, you know, one could argue that the healthcare organizations are rolling in it. Their profits are soaring and our premiums are going up.
True.
Do they really need to receive a tax cut of $100 million?
Well, I think as it turned out, this is what you would call a win-win situation. It's a win for the providers. It's also a win for the clients, so that the Medi-Cal system would still be providing resources at a substantive level to support the needs of the working class families in our state.
Is there any obligation that they pass off this $100 million as a savings to the premium payer?
Well, I think at the end of the day, when you see the fact that we were able to receive the money from the federal government, that means services will be met and at a higher level. And so I think that, as I say, it will be a win-win across the board.
But is the third winner also the consumer?
The consumer will be a beneficiary in this as well.
So let's talk about the ability of the legislature to get all the votes it needed, because it needed a 2/3 vote, which meant you needed at least one GOP senator, you needed at least 3 GOP assemblymen. I'll talk about your body, because you are the majority leader. You're whipping up those votes, and you needed 3 Republicans. You got 11.
You know, a lot of credit goes to the minority leader, Chad Mays. I think he and his leadership of his caucus did a great job in terms of working together, understanding the importance of moving this, passing this measure along. And, you know, I think that they recognized that, and they had a lot of organizations that would traditionally be against what would be considered a tax increase, supporting or neutral on the bill.
The Cal Chamber came out in support. Howard Jarvis came out neutral. What's your sense as to why those organizations, which, like you said, we would have expected to oppose, either were in support or neutral?
Well, I think it's because they drilled down on this and saw that ultimately it was going to be tax savings for some of the providers, for many of the providers, and that's a good thing. And even though it's described as a tax, the real effect of it is that it did not increase as it related to the health providers, and the benefits to the clients were going to be realized. So both parties, when they stand on their issues of, you know, fighting to make sure that there aren't tax increases on corporations or individuals, they win. Those who say we need to expand services for those who are disadvantaged, they win.
And let's talk about another piece of legislation passed on the very same day, and that was a $300 million item for the developmentally disabled. It included higher wages for staff at regional centers, increased money to support independent living programs. Your friends on the Republican side of the Assembly were really, one of their critical issues was enough money for certain nursing facilities that were going to be phased out. So why was it that, or was there a linkage?
There was a linkage to some extent. I think they stand alone, but at the same time, I think that there was we viewed it as a package, that it was going to be making substantial increases in areas to the disability community that had not been seen for many years, and it was well beyond time for us to reinvest, and this gave us the opportunity to do so, and it helps us meet the mandates of the Lanterman Act, which really to make sure that we are going to meet a baseline of services to the disability community, and to keep that promise, you have to keep investing.
Do you have a sense as to why the Republicans in the Assembly were so fixated on the developmentally disabled? And to their credit, this isn't one of their traditional constituencies. And they fought mightily for this $120 million, as I said, for certain nursing facilities that saw cuts. I guess they were passed 5 years ago, not that were upcoming.
Right.
What was going on there?
I think that personal investment in some of these issues is what really causes members to sort of move.
Oh, I see.
So if you have a family member or you have a friend of a family member, someone who touches you in a personal way, where you can see the struggle, you can see the day-to-day challenges, and it can't help but pull at your heartstrings. My niece has a disability, but she's a fighter, and she's out there and she's working hard to learn at school. And so you want to make sure that they need more, and you want to make sure that they have what they need so they can have as healthy and balanced and productive a life as possible.
Look, it makes sense in some ways, but if I were doing a paper on this day in the Capitol, I would not have predicted the paper would include that our friends, your friends in the Republican Party, would be so strong behind this constituency, taking nothing away from the Republicans. I'm a nonpartisan, I'm a journalist. It's just, you got to admit, it's a little surprising.
Well, maybe it's also a harbinger of things to come. I mean, maybe it's an indication that we have to invest. We can't just cut. I mean, it's just we get to the place where we have those who are in most need are the ones that will suffer the most. And so we have to make sure we're continuing to invest in health and human services, in education, and we have to do that in infrastructure. And if we don't do that, then it starts to crumble down around us.
Let me ask you as well about another proposal passed that day. It dealt with debt. I guess $240 million was set aside to pay off liabilities for retiree health care for public workers, pay back a transportation loan. We know the governor is very focused on debt reduction, as are your friends on the Republican side. Was that also part of the whole package? We needed to see some monies go towards debt reduction?
This was all a comprehensive strategy that was part of a months-long negotiation, both within our caucus, but also the Republican caucus and the governor. And I think the governor, to his credit, he created this special session to give us the opportunity to sort of fix some of these things and to bring it all together. And I'm glad we were able to do that.
Let's talk about this last month and the ability to come together as Democrats, as Republicans, and get this package of bills passed. Why is it working? What is it about Sacramento, as opposed to Washington, D.C., for example, that I can walk into a restaurant in Sacramento and see one Republican member having dinner with a Democratic member? I don't think I would see that in Washington, D.C.
Yeah, I think part of it, I think a couple of things. I think one, I think that all of us like each other. I think that I think that there's a genuine like. Everyone is a good person at their core, and I think they're here to do the right thing. Separate and apart from that, I just think that our districts, under the redistricting plan that led us into this new era of term limits, that you have members who come from different kind of districts. They're not all hardline blue or hardline red. So you have constituents that you have to pay attention to that might have a little bit different point of view, and sort of in some instances moves people more towards the middle.
And it's to the benefit of California. I mean, we are getting important matters handled. We could have lost over $1 billion, but the parties got together. Congratulations.
Thank you. And it's spread around to a lot of people.
Of course. He is the majority leader of the California Assembly. His name is Holden. I'm Brad Pomerance in Sacramento. This is Local Edition.